Turning 65 can feel like a finish line. After decades of working, paying taxes, raising a family, and trying to save enough, Medicare can sound like the moment healthcare finally becomes simple. But this is where many people make a costly mistake. They think turning 65 automatically protects them. It does not. Medicare can help, but Medicare also comes with deadlines, choices, penalties, and rules that are easy to miss when life is busy. And the painful part is this. Some Medicare enrollment mistakes do not hurt only once. They can follow you for years. A missed deadline can create a late penalty. The wrong assumption about employer coverage can leave a gap. Ignoring drug coverage can become a monthly cost later. Choosing a plan too quickly can limit doctors, hospitals, or flexibility. And if you have a health savings account, one timing mistake can create a tax problem you never saw coming. So today, we are going to walk through 5 Medicare enrollment mistakes people make around age 65. Not to make Medicare feel scary, but to make the danger visible before it becomes permanent. Mistake number 1 is missing your real enrollment window. Most people know Medicare starts around 65. But many do not understand the calendar. Your first Medicare enrollment window is not just your birthday month. It begins 3 months before the month you turn 65. It includes your birthday month. And it continues for 3 months after that. That 7-month window matters. Imagine Karen, age 64 and 9 months. She is helping her daughter, watching the grandkids, and trying to clean up old bills before retirement. She keeps saying, "I'll deal with Medicare when I turn 65. But by the time she starts paying attention, the easiest part of the window has already passed. In scenario A, Karen checks the calendar before her birthday month. She knows when her window opens. She knows when coverage can start. She is not rushed. In scenario B, Karen waits until after the birthday party, after the paperwork piles up, and after the mailbox is full of confusing letters. Now every decision feels urgent. That is how mistakes happen. The danger is not that Karen is careless. The danger is that Medicare has timing rules, and the system does not slow down just because your life is busy. If coverage starts later than expected, a simple doctor visit can become stressful. A planned retirement date can feel less secure. And a person who thought they were organized can suddenly feel behind. Mistake number 2 is assuming employer coverage automatically lets you delay Part B. This one catches people who are still working at 65. They think, "I have insurance through work, so I can ignore Medicare for now." Sometimes delaying Part B can make sense if you have qualifying coverage from current employment. But the word qualifying matters. Not all coverage works the same way. COBRA is not the same as active employer coverage. Retiree coverage is not the same as active employer coverage. A spouse's plan may have rules you need to understand. And small employer coverage may coordinate differently than large employer coverage. Imagine Mike, age 65. He works part-time and still has a health plan connected to his job. He assumes that means he is safe. So he delays Part B without asking the benefits office how the plan works with Medicare. For a while, nothing seems wrong. Then he retires. Then he tries to enroll. Then the questions begin. Was the coverage based on current employment? Did his special enrollment period already start? Did he wait too long? In scenario A, Mike calls the employer benefits office before turning 65. He asks how the work plan pays once he is Medicare eligible. In scenario B, he guesses. That guess can become expensive. And the worst time to learn that is after the job has already ended and the clock has already started. Because after 65, a wrong assumption about Part B can create a gap in coverage, a delayed start date, or a late enrollment penalty. This is why, "I still have insurance," is not enough. The real question is this the right kind of coverage to delay Medicare safely? Mistake number 3 is skipping Part D because you do not take prescriptions now. This sounds logical. If you do not take medication, why pay attention to drug coverage? But Medicare does not look only at what you need today. It also looks at whether you had creditable prescription drug coverage after your enrollment period ended. Creditable coverage simply means drug coverage that is expected to pay at least as well as Medicare's standard prescription drug coverage. If you go too long without Medicare drug coverage or other creditable drug coverage, a late penalty can be added later when you finally join. Imagine Elaine, age 65. She is healthy. No daily medications. No major conditions. She hears about Part D and says, "I don't need that." 2 years later, her doctor prescribes a medication she will probably take for the rest of her life. Now she wants drug coverage. But the decision she made at 65 may still matter. In Scenario A, Elaine checks whether she needs a low-cost Part D plan or whether her current coverage is creditable. She keeps the creditable coverage letter. In Scenario B, Elaine ignores it because she feels healthy. That is the trap. Health can change faster than paperwork. And a prescription drug mistake often does not feel urgent until the month you need the medication. By then, the cost is not just the medicine. It may also be the penalty, the delay, and the stress of fixing something that could have been handled calmly. Mistake number 4 is choosing between Medicare Advantage, Original Medicare, and Medigap too quickly. A lot of people treat this like choosing any normal insurance plan. They look at the premium first. Then they pick the option that seems cheapest. But the cheapest looking plan is not always the least expensive plan for your life. Networks matter. Doctors matter. Hospitals matter. Travel matters. Prior authorization can matter. Prescription coverage can matter. Out-of-pocket limits can matter. And with Medigap, timing can matter too, because your Medigap open enrollment period is connected to being 65 or older and enrolled in Part B. Imagine Robert, age 65. He sees a plan with a very low monthly premium. It looks simple. It looks affordable. So he enrolls fast. But months later, he discovers that one of his doctors is not in the network, or that a specialist visit works differently than expected. Now the plan is not just a monthly premium. It is a system he has to live inside. In Scenario A, Robert lists his doctors, hospitals, prescriptions, travel habits, and budget before choosing. He compares how each option works in real life. In Scenario B, he chooses based on the first number he sees. That is dangerous. Medicare is not only about what you pay each month. It is about what happens when you actually need care. A low premium can still come with trade-offs. A higher premium can sometimes buy predictability. The mistake is not picking Medicare Advantage. The mistake is not picking Original Medicare with Medigap. The mistake is choosing before you understand the trade-offs. Mistake number 5 is forgetting how Medicare affects health savings accounts. This is a quiet one. But for people still working at 65, it can matter a lot. If you are enrolled in Medicare, you generally cannot keep contributing to an HSA. And if you sign up for premium-free Part A after 65, that coverage may start retroactively, going back up to 6 months, but not earlier than the month you became eligible. That can surprise people who keep making HSA contributions while delaying Medicare. Imagine John, age 66. He is still working and has a high-deductible health plan with an HSA. He likes the tax advantage. He keeps contributing. Then he decides to sign up for Medicare and Social Security. Only later does he learn that his Medicare Part A start date may go backward. Now the question becomes uncomfortable. Did he contribute to the HSA during months when he was already considered enrolled in Medicare? In Scenario A, John asks about HSA timing before applying. He checks when he should stop contributions. In Scenario B, he applies first and asks questions later. That order can create problems. And this is the larger lesson behind all 5 mistakes. Medicare enrollment is not only a healthcare decision. It is a retirement decision. It touches monthly cash flow, taxes, employer benefits, prescriptions, doctor access, and your sense of control. So if you are turning 65, slow down. Do not wait until the last minute. Do not assume your work coverage protects you without checking. Do not ignore prescription coverage just because you are healthy today. Do not choose a plan only because the premium looks low. And do not keep making HSA contributions without understanding how Medicare timing works. Medicare should not become the mistake that makes retirement harder. The strongest move is not guessing. It is writing down your dates, checking your coverage, asking the benefits office, saving your letters, and reviewing your options before the pressure begins. That is preparation. If you are over 50 and want to avoid the retirement traps most people discover too late, subscribe to Money After 50. This channel helps you understand the money decisions that can protect your income, your savings, and your retirement before life gets expensive. This video is for educational purposes only and does not provide financial, tax, legal, or investment advice. Always consult a qualified professional before making financial decisions.